In 1974-75, we tried to clone and purify the human and rat enzymes, HO1 gene, the inducible one, and HO2 we saw it as a contaminant. It turned out to be a real gene. Originally, heme oxygenase been thought to be cytochrome P450 until Dr. Kappas, vice president of Rockefeller University, told me, it's your job to let me know as a postdoctor within 9 months to tell me if it's heme oxygenase cytochrome P450 or just heme oxygenase. It turned out to be really, it's not a cytochrome P450 because when you induce HO1, this enzyme, HO1, you degrade cytochrome P450 and regulate many heme proteins. Now, many substances like statin, aspirin, ischemia, and many numerous metals and drugs are potent inducer of heme oxygenase. Now, many drug companies, I'm collaborating with them, are targeting heme oxygenase for cardiovascular disease. Now, induction of heme oxygenase can regulate many heme protein, as I said, and an inflammatory mediator to be decreased. Now, originally we thought the only function of heme oxygenase is to cause jaundice in newborn baby. We never know then in 1975, 1976 that heme oxygenase has any other function but make bilirubin the bad guy. That bilirubin, the bad guy, turned out to be the most antioxidant as been shown earlier. And in fact, patients who have Gilbert disease do not develop cardiovascular disease because Gilbert disease patients have about 2 to 3 milligrams DDL of bilirubin in their body, and that prevented all cardiovascular disease in this patient. Now, also, the CO is a byproduct of heme oxygenase. We saw it's a toxic substance. What's the CO needed for? It turned out CO is a very important regulator of vascular endothelial cells and vascular smooth muscle cells. If you induce too much of heme oxygenase, you inhibit vascular smooth muscle cell growth, but you improve endothelial cell function. So as a result of that, I'm interested in translational research, so we would decide to develop some drugs to prevent stenosis and vascular smooth muscle growth, and you prevent atherosclerosis. Iron, which is a ferritin, also is a very important factor that acts as an antioxidant, and lots of studies done by in Jerusalem, Hershko. He did lots of study and collaborated with him on that, but we never published together. Finally, which I wanted to discuss with you, that HO2 is a regulator of the basic function of various cytochromes, but HO1 is an inducible one when you have hyperthermia, if you sit in the sunlight. If you induce heme oxygenase, you can prevent skin damage, you can prevent various things. So now we'll move on to the second slides to show you in 1970, 1990, 78, 79, 1992, we show that HO1 and eNOS is expressed in bone marrow as stroma cells. At that time, we never know bone marrow stroma cell is mesenchymal stem cells. Now, overexpression of HO1 there, regulating hematopoietic stem cell, we published that in numerous papers with Ron Hoffman, Ed Benz, and Bernie Fournier from Yale, and we show this is a very important regulator of stem cell development. So much expression of superoxide in the bone marrow is very bad for stem cell differentiation. So we have to be careful how much superoxide is generated in the bone marrow. Now, why is that? Because mesenchymal stem cells itself regulate release of hematopoietic stem cells. Also, mesenchymal stem cells go to become bones or become adipocytes. When you see in the following slides, you can see here that mesenchymal stem cells, which we used to call a stroma cell, can give you bones, can give you cartilage, can give you cardiac tissues, can give you stroma, can give you tandem, adipocyte, neuron. All that can come from mesenchymal stem cells. Now I want to go back to these slides here to tell you most physicians have used for cardiovascular disease have used stem cells to prevent ischemia in human heart. How it can stem cell can prevent the ischemia. If a stem cells, all what it does, it gives you these lineages. What they should have been doing really is to use these cells, because this cell is the one who give you a cardiac tissue and give you myocyte, give you other cells. What will come this later on. Now, if you look at the development of cardiovascular disease for the last 25 years, the only improvement is from conventional 44 to 24%. So all this study for the last 25 years or 30 years, the improvement in the cardiovascular disease is only from 44, only 20%. So you really will have to look to cocktail of various drugs to prevent the cardiovascular disease. And that cocktail may be related to the heme oxygenase 1 as a target. Now, I have a good friend of mine, his name Fogelman, Alan Fogelman. He's the executive director of medicine of UCLA. He told me, Nader, what happened if this peptide, L-4F, D peptide or L-4F, which is APO1 mimetic protein, I'm not going to tell you how it works, but I'll show you that peptide. What does this do to the heme oxygenase cardiovascular disease? I was so lucky that he gave me that. So one of the objectives when I want to show you is to determine whether diabetes and metabolic syndrome are a result of genetic defect and what this heme oxygenase does. Secondly, what is the mechanism by which HO1 gene, which is induction, can increase adiponectin? And what is that to do with insulin-resistant and obesity cardiovascular disease in mice as well as in human? Now, if you look at the originally stem cell transplantation or isolation is to use stem cells come from any place where you can see after you inject it, it goes directly to the lung, almost 60–70% to stay in the lung, few cells goes here, just a stem cell. Now if you look at the new method which we have, is to isolate the stem cells from here. I'm sorry for the noise, but Kruger did the slides for me. So you blame him for that. He was a cardiology work with me. And then you inject that directly to the patient. So now you isolate bone marrow CD34. You purify it. You have CD34 and mesenchymal stem cell, and you inject it directly into the bone marrow patient. So what we have done first is to see if CD34 cells or mesenchymal cells with the CD34 are playing a role in diabetes and obesity. This paper already published, but we have done, we took a DB mice with CD34, or DB mice CD34 L4F, or CD4 mesenchymal stem L4F. Why I'm using L4F here? Because Dr. Fogelman have shown earlier before me has antioxidant. So I said, what is the mechanism? It turns out this antioxidant effect is related to induction of HO1. HO1 gene is a very powerful antioxidant in our body. So what we have done when we did the transplantation, you can see here, this is a non-DB mice. This is the glucose level, glucose tolerance levels. And this is the DB transplanted with DB. This is the DB with CD34. Here, when you transplanted with adherent cells, which is mesenchymal stem cell, you can see almost parallel to the lean. It tells you that the defect is not the CD34 in diabetic patient, but the defect is reside in mesenchymal stem cells. So diabetic type 2, in fact, we were able to cure type 2 diabetes by mesenchymal stem cell transplanted. The problem with using this method is too expensive. In America, it costs $120,000 to do the transplantation, and if you do mesenchymal cell, another $50,000. So only the rich people can afford, because healthcare company will never pay. They rather to see you sick slowly than cured in one time. So that's the story. Now I wanted to move along to see, since I'm interested in translational research, what happened in patients. So I present to you some clinical application on mesenchymal stem cell with the CD34 cells. What you can see here, our objective is to assess whether injection of GCSF to mobilize CD34 cells and in combination with purified mesenchymal stem cells in and around post-infarct ischemic area would restore local contractility, global cardiac function in diabetic patient. So when we move on, we do IBBMT, yield this, purified, and we count the number of cells. With selection, we use some of cells, but then we inject this. The criteria is the patient must be diabetic, is scheduled for coronary artery bypass, and on the top of that, they are more than 70 years of age. And the method is they have infarcted, they are stable for 3 to 4 days, 5 days. You mobilize, you isolate either bone marrow, which we to compare, or peripheral blood. Then what we have done here is to show you the schematic, what we do. Then finally you purified mesenchymal stem with CD34, purified, and then you start injecting this point. And then I just want you to look only this part here. I hope you can see my pointer. The patient, to evaluate the improvement in the patient is to, by New York Health Athletic, is the patient move from stage 4, which he can hardly move. If he moved from bed, he'll be so tired. To stage 3, which I don't see the pointer, here's stage 3. Or from stage 4 to stage 3. But here you have these two patients dramatically improve from stage 4 to stage 2, stage 4 to stage 2. But we only did few patients, 7 patients. You can see there is improvement in the patient health, improvement in his physical activity, and that's only by mesenchymal stem cells with the CD34 combination. There's no other bypass. The patient was scheduled to do bypass, but he was not doing bypass. But we can do more because it's very damn expensive, and not too many companies are willing to pay the cost. But here is what we have. So in summary, 5 out of 7 diabetic patients respond to mesenchymal cell CD34 and were able to regenerate post-infarct ischemic and echinoctic area. Patient was discharged to rehabilitation program after 6 to 8 days. Supraventricular arrhythmia did not occur up to 12 months during the follow-up. MCD34 mesenchymal stem cell with ibone can directly use for regeneration cardiac post-infarct tissues. So we're able to show that in fact you can prevent ischemia if you can give them combination, ischemic damage in patient, prevent bypass surgery if you give them combination with mesenchymal cell and CD34 cells. Now I move to the second part of my talk. Just give you a flair about what we are doing. In half an hour, Dr. Aviram told me, you only half an hour, so I told him, okay, what I can do with half an hour. He said, well, it's your problem, you figure out what you're going to do. So I decided to give you some touch on every project which we do. Maybe you guys are interested. We come to visit me in Toledo, very beautiful country. But it's not as beautiful as Israel. I learned so much about history here. I learned so much about history, especially what the name of the city was yesterday. Like that? Megiddo. Megiddo. My goodness, 20. I mean, it's incredible. Echo. Everybody in the nation want to invade Israel, to take part of Israel. I mean, can you imagine? From the Crusader, the Salah ad-Din, everyone? Huh? Until today. Until today. Anyway, so what I'm trying to see now, what L-4F anti-apoptotic does to obesity and diabetes. So what we have done, we hypothesized that apolipoprotein mimetic peptide, L-4F, which induced arterial antioxidative enzyme, is vasoprotective in rat model as well as in mice. It would ameliorate insulin resistance and diabetes in obese mice, either rat or obese, but that's what I'm going to show you. Mice injectable L-4F every day, 200 microgram per kilo, almost the same dose as statin. And then you measure global fat, you measure kidney, aorta, and fat tissue, HO1 and other, and all signaling, any signaling you can think of, we measure it, but I'm not presenting the results too much. And then we get bone marrow, mesenchymal stem cells, adipocyte, osteoblast, measure serum inflammatory cytokine, IL-1, IL-6, TNF, adiponectin. Also measure fat tissue, the pool around. So look at this beautiful picture. You look at this guy here, nice and happy and fat. Look at this guy, skinny guy. He doesn't look good. This guy is fat and he looks fine. You look at the fat here, you can see lots of fat about this guy. Now what happened, when you keep him on an L-4F diet, he loses weight and doesn't look good anymore. You can see. And he loses lots of fat. Now, how about HO1? You can see lean with L-4F, huge induction of HO1, huge induction of activity, HO1 protein, and HO1 activity in the lean as well as an obese. So L-4F is effective in induction of HO1 in both lean and obese. And we have 3 drug companies now are made of fantastic drugs. You give it at 1 microgram per kilogram body weight and prevent cardiovascular disease. I'm not telling you the name of the company until they publish and go clinical trials. So here what you have. What is fascinating about obese mice? You see the adiponectin levels is very low, statistically low compared to lean. When you inject L-4F, look at this. Huge induction compared to lean or obese. That is prevented if you inject inhibitor of HO1, 10-mesoporphyrin. You reverse it. So what happened when you have less adiponectin, you have more IL-6, you have more TNF, you have more IL-1. If you induce HO1 by L-4F, you have more adiponectin, you have less IL-6, less TNF, less, what is this? Anybody can see? Huh? IL-1. No, I was testing you, I was testing them. All right. Now, if you inhibit HO1, you have less adiponectin, you have more IL-6, more TNF. So you really, L-4F may have other beneficial effect. But if you inhibit HO1 there, you can reverse all obesity, all inflammatory. How about blood glucose? Look at the blood glucose. Blood glucose for glucose tolerance test to show you obesity, insulin, glucose intolerance. Here you have lower. With the insulin tolerance test, you see not really too much statistically different, but this guy who's receiving L-4F, almost, if you give him a higher dose of insulin, you may kill that mice. In fact, some of mice become so insulin sensitive, some of them died from us because we did not pay attention how much glucose there. So really, L-4F is fantastic drug, and now is being given to 4,500 patients, and the toxicity is perfect and is acting to control obesity and diabetes. And that drug now, Dr. Fogelman transferred to Novartis, so Novartis has these drugs. But I'm lucky that I was in the first stage of this development. So now we look at MRI, this beautiful mice, little bit mice, you go to MRI machine, huge MRI machine, goes slap right in, and see what happened. You can see here the visceral fat, and this is saturated fat. You decrease, L-4F decreases both, but it decreases more in visceral fat. Visceral fat is decreased. That's the source of inflammation. More than. Now, if you look at that very big, nice size fat cells, you can see it? Very beautiful and big around it. My goodness. When you give L-4F, it becomes shrinking, becomes a smaller fat. Smaller fat is the healthier fat. The bigger fat is inflammatory fat. So the chief of medicine, this friend of mine, when he sees me eating nice big steak, you tell him, remember your adipocytes are getting bigger and bigger. I stop immediately. I switch to something else. Look at the C, the subcutaneous and visceral fat become too small. All right, we'll move to the second one. Here you can see it in isolated adipocyte. We take the bone marrow from this, you see how it happened here? Bigger fat, bigger adipocyte, bigger, smaller with L-4F. If you inhibit phospho-AKT inhibitor, you can reverse back by LY29. I don't see the point. LY29, you see how big it is? Nice big size compared to the shrinking side with L-4F. So you can see here, LY inhibit L-4F, L-4F lower it. You can reverse it by inhibition of phospho-AMPK. The large droplet is smaller with L-4F. The smaller cells is the more with L-4F. Now, this is the most fascinating slide. We just published in Bone 2 papers this month to show you when you give L-4F to adipocyte, the lower number of adipocytes. Here it is. If you give to osteoblast, you make more osteoblast. And that's a major problem in diabetes. If you prevent oxidative stress in the bone marrow, I didn't show you all the work. You guys have to make your homework and look all my papers. Very fascinating papers. So if you go in the bone marrow, you see the bone marrow full of fat in obese and diabetes. If you induce antioxidant in the bone marrow, you convert all that fat to osteoblast. And osteoblast is a major problem in type 2 diabetes, also in obese. So here you have induction of heme oxygenase in this system happen to prevent adiposity and increase bone marrow formation, which is very essential, not just increase the bone marrow formation. Bone marrow, making bone marrow need to be, I'm sorry, I took more time. I will quick. What happened with the female? The female behave the same as the male, but the female do not lose weight as much as male. That's a major problem. Now, but the good news, what the good news is, I'll come to it later on, that the inflammation in the female, adiponectin in the female goes much higher than the male. And the inflammation goes even lower than the male. What is the most important in the female? That if you look at here, testosterone goes down with the female. It goes up in obesity, but it goes down with L-4F. When you inhibit heme oxygenase, reverse it. Now, what the most interesting, estradiol, this results not been published, by the way. What the most interesting, the estradiol is much higher when you give L-4F. That's a very important in hormonal levels. If you look at the male, the testosterone level is decreased with obesity and increased with L-4F, and that should be my last slide to tell you that L-4F increases HO1, increases bilirubin to prevent lipid stress and fatty acid reactive species, CO enhance, make a smaller adipocyte to give you more adiponectin, increase in sensitivity. If you don't have HO1 or L4F, you have a nice looking large adipocyte, all this inflammation come and give you insulin sensitivity is decreased, and that's the final people who've been working with me. I'm sorry I took extra 5 minutes. Thank you.